Hi to everyone. Today we are going to discuss an important patient population who presents to plastic surgeons. Patients who want their nose shape to be better, they usually present to the plastic surgeons. They usually have two important complaints. Either they have the breathing problems, or if they don't have the breathing problems, they want their nose shape to be better. However, majority of the patients who presents to us do have both of them. So it is the relieving the breathing problem is an important component of rhinoplasty. So today we are going to present the video of a patient who presented to us for the relief of his breathing problems and improvement in the shape of his nose. The patient came to us from England. He wanted his surgery to be done in Pakistan with a good team of surgeons and a better team of surgeons. So here we are going to present his journey through rhinoplasty. This journey will help you in understanding many aspects of rhinoplasty and what happens to the patient during the surgery and after the surgery. So please listen to him. Thank you.
Assalamu alaikum. My name is Farhan Hassan and I am 24 years old. I underwent the rhinoplasty surgery on the 9th of February 2021, which is roughly 2 months ago. So I'm about to complete 8 weeks since the surgery took place. The overall experience has been excellent, and I was very well briefed before the operation, and all the questions, whether silly or relevant, were answered with great detail, which made me very comfortable to go ahead with the procedure. The recovery was quite incredible, and approximately 2 days after the surgery, I was back on my feet, and on the third day, I resumed work, which is online, of course, but I could sit in front of a computer screen once again. The first few days, the first week perhaps was slightly tough when it comes to mobility and the overall feeling, because there was nasal packing inside of my nostrils, which was eventually removed after the first week, and then the splints, etc., were removed after the second week. I have not experienced any sort of pain at all to date, which is something that I was warned about before the surgery by several individuals, but I've been comfortable throughout. Of course, there was some sort of an irritation when you feel like scratching your nose and you cannot do so because there's a cast on your nose, or when you feel like sneezing and you need to forcefully restrain it, and if you can't, you need to sneeze with your mouth open, something we don't do quite often. So that was the only point that was a little irritating, but that was, of course, something I was told, and it was part of the surgery. Initially, when I would tilt my head to either one side, I would feel like my whole nose is moving with it. But of course, I was also told that I will feel some different sorts of sensations on my nose when I touch it, when I try to move my head around, and that has gone away with the passing of every single day. I've been sleeping elevated for the purpose of recovery, elevated on 2 pillows for about 2 months now, ever since I came out of surgery. But with every single passing day, my breathing, I feel, is better. I've never experienced such clear breath coming out of both nostrils for so many years that I can't even remember. I still do experience a blockage on one nostril, but then that opens up on its own, the other nostril, and then sometimes both of them open up. But I think that's still part of the recovery. The main things that were corrected were the inside the deviated nasal septum, some deviation on the front, and the dorsal hump was reduced slightly, which was affected over the past few years in my growing years. I had dried up blood that used to come out of my nose, but with every passing day, my nostrils cleared out and I could breathe better. And now I'm very comfortable completely. I've after the first 2 weeks, when the initial splints and the cast was removed, I had to put stereo strips, and with every weekly follow-up visit they were revised. Now those have also been removed, and this skin, I've been instructed to hold it to one side because of the memory of the soft tissue, which is pushing it to one side like it was before. But this has also improved in the past 1 or 2 weeks, and is getting better with every day. I had a consultation with doctors abroad, but I was not very confident, and I did not feel comfortable. And I'm happy about the fact that I chose Pakistan because for the surgery, because the competence of the doctors is undoubted, and I was made very, very comfortable to go on with the procedure. I hope I've not missed out on anything, but if I have, there's a write-up that is attached with this video, so hopefully that should cover up for anything that is left out. And yes, I would like to thank Dr. Mustasin for all the time he's given and gone through the whole procedure with me. Thank you.